Present, I'll go ahead and call the Air Pollution Control Board to order. It says approve August 21 minutes, but I haven't seen any.
No, unfortunately, they're not ready.
Right.
We'll bring them next.
So not quite ready. So then we have an action item to set a public hearing for December 18, 2014 to approve an application to redesignate Missoula from non-attainment status to maintenance status. PM10. Woo, big deal.
It's like watching your whole life go by, isn't it?
Oh,
Might be.
Wonder how many years we've been talking about this. Sarah,
All right, thanks.
you're on the
Yeah.
agenda as the spokesperson for this. This is your piece of work. And Ben's, and Jim's.
Mostly Sarah's.
Pardon?
At this point, mostly Sarah's.
Okay. Oh, the wrong one.
It's a pretty thick piece of work, I might
Yeah.
add.
I loved out some appendices too, so it's kind of yeah, so Sarah Coefield with Air Quality. We have a really short little presentation to kind of give you a quick little overview. But the long and the short of it is we are preparing to request EPA to let us redesignate from being a non-attainment for PM10 into maintenance, which will help remove the stigma of being a non-attainment area for a pollutant we have not had a problem with in 25 years. So PM10, for those who might not be terribly familiar with it, is particulates that are 10 microns in diameter or smaller, so it includes all of PM2.5, which is what you see mostly from combustion sources and wood stoves, and up to larger sources such as wood dust. The PM10 you see around here has a lot of the crustal factor to it, silicates and stuff, so we really say a lot of road dust in our PM10. The National Ambient Air Quality Standard for PM10, there's only one. It's for 24 hours. They dropped the annual several years ago, and that standard is 150 micrograms per cubic meter. We have not had a problem with that since 1989 was the last time we violated the PM10 standard. At that time, it was largely due to a combination of wood stoves and road dust. We've been able to put LF control measures in place since then to dramatically decrease both of those sources. Road dust we approached by making sure new roads and driveways were paved, setting up requirements for street sanding material, putting in deasser requirements, and also having mandatory street sweeping to go through and clean up the leftover sanding material every spring. And then with wood stoves, obviously we've gone through and removed a bulk of the wood stoves that were in town. So all of those combined has meant we've seen a huge decrease. We on average are about 1/3 of the standard, which is well below any kind of margin of safety you could be concerned about. So that's really nice. So we're submitting this request to EPA. It's called a limited maintenance plan. EPA set this opportunity out in 2001, where they're calling it a more streamlined approach to being redesignated. And really what that changes toward it from a traditional redesignation request is you don't have to take your emission inventory and project it forward for a decade or two. So you can just do base year emission inventory, because if you've had excellent data for several years and you have good control measures in place, you aren't likely to have a problem in the future, so they let you kind of avoid that. But you still have to go through and do a complete emission inventory for that base year and show you have good data and show you have good control measures in place, and that will stay in place to keep you in attainment with that standard. So this request, it's going to be larger. I've already got this. This was like pretty much the first draft. I've been able to get some comments back from DEQ and a couple folks at EPA. I'm going to send it out to another person at EPA later today to get additional comments, with our goal of having it something that's just going to go right through when it does get to EPA. And so there's going to be a few more appendices in here that are mostly things that copies of our rules and some more background data that went into stuff that I didn't want to overload you too completely with. I feel like you got plenty anyway. And that full version will, of course, be have to be completed and ready for anybody to look at by the time we do the public notice for a hearing. So here's just a real quick look at the data. When you look at design values for PM10, it's different than PM2.5. PM2.5 is looking at your 98th percentile, so you can have up to 6 days over the standard in a given year and be okay, and it's based on a 3-year rolling average. PM10, you're considered in attainment unless you have an average of 1 day per year in a 3-year period that is over the standard. So it's more based on if you have a day off on average over a 3-year period. So it's really very different. They're very interested in your maximum values instead of, say, your 6 maximum or something like that. So this is showing you our first and second maximum values from 95 to 2013. Most of the wildfire data that has been taken out of this particular chart, DEQ just submitted the 2012 wildfire season as an exceptional event, so that'll help smooth that graph out a little bit. Because we can't regulate lightning no matter how hard we try, we get a gimme for high values during wildfires because we can't regulate that away. So that'll smooth that graph out even more and kind of put us down where we normally see for the rest of the year outside of wildfire season. And again, because PM10 includes all the smoke you see from wildfires, is the PM2.5 fraction, that's why we see high PM10 values during wildfires. Part of the requirements for this was making an emission inventory. We chose 2010 as the base year of that, based primarily on data availability. We had the long-range transportation plan. We had to have conformity work being done for that, and so we had a lot of good vehicular travel information already completed by the travel folks, transportation folks, and then also it was a census year, so that gave us some additional good population data, because when you're going through and doing emission inventory, there's a lot of gathering of even housing data and population data and how many people were likely using snow blowers on a given day. So a lot that goes into that, and based on data availability, we chose 2010 as our base year emission inventory. It's not terribly comparable to what was done back in the 80s when we were first designated as non-attainment based, because emission factors have changed, methodologies have changed really dramatically. This is quite a bit lower than what was put in the 1990 emission inventory. But what is more interesting to me is the sources that are the primary sources in that emission inventory. Transportation is about 70% of our PM10. About 60 of that is just from fugitive dust on paved roads, and the rest of it is coming off of brake wear, tire wear, and exhaust. So our transportation controls are clearly going to be important going into the future. Residential wood burning in the 80s was a solid 42-ish% of the emission inventory, and so we really cut down that piece of the pie by going through and getting those wood stoves out of this area. So it's changed the how the pie looks, and also our emissions just are quite a bit lower than they were when this whole thing started. So this is an update to our SIP, the State Implementation Plan. We are the lead agency here, which is why we put together the document, and are kind of, it's our work. We will be doing consultation with the Advisory Council, TTAC, and TPCC, so they know this is happening and they can comment for the hearing. So the approval process, because it's a SIP update, will go through the hearing here. Then it'll be go through County Commissioner, City Council, then it'll go to the Governor. Does not look like it has to go to Board of Environmental Review because there aren't really any changes to the regulations being done. We're going to keep all of the same rules we have in place because they've been working. And then it will go to the EPA, and they have 18 months to make a final decision. And that's what I've got. If there's any questions, I'm happy to answer them.
Questions from board members?
Just curious about how what happens at Seeley Lake affects this whole process?
It really doesn't. This is PM10, and we don't have a PM10 monitor in Seeley. So,
But we had it. for
we have it,
years.
well, in the
Yeah.
past there was, but this is based on our PM10 data for Missoula right now, Seeley Lake. PM 2.5 could definitely become an issue in Seeley. That'll be a whole different process.
Right,
It'll
that's-
be a giant process if it comes to
I think
pass.
Ben wanted to clarify matters.
Oh, if I
Or
can make
make-
a comment on PM10 in Seeley Lake, we did have a PM10 monitor in Seeley Lake for several years. Seeley Lake has historically, or had troubles in the wintertime from wood smoke. It had very low fugitive emissions compared to what Missoula had in the past. The PM10 monitor very rarely had much value, or had values only slightly higher than PM 2.5 occasionally. That monitor was discontinued and served no purpose, not even close to the standard.
Okay, thanks.
Yeah.
Just a question, is it just the air stagnation zone that applies to this, or does it get attached to the whole county?
I'm sorry, can you repeat that?
Well, it was exactly what he was.
Oh, well, okay.
Yeah, so-
That works.
We have an air stagnation
Yeah.
zone.
So you have, in the appendix, I think it's the second appendix B, we have our maps. So the air stagnation zone includes the city of Missoula and about a 4-mile radius outside of it. The PM10 non-attainment area is quite a bit smaller. It's really much more aligned with the city limits. It goes up the Rattlesnake a little bit. It goes a little bit down in the Mill Creek area, but not all of it. And it incorporates out into the target range area. But it's considerably smaller than the air stagnation zone. And so that's hopefully.
Except on EPA maps, when you look at non-attainment areas, they blacken in the whole
The whole
county.
Yeah, they like to do that, but our non-attainment area is actually really pretty small.
Well, that helps.
So this would go to this board, the county commissioners, the city council, and the governor for approval to then send it on to EPA?
Well, the governor submits the redesignation request in a
Because
letter.
it's a state
Yeah.
implementation.
And so it officially comes through the governor's office to the EPA. And getting the DEQ has told us that it can take up to a month, I think, to get that letter from
Right.
the governor.
So they don't, actually, the city council and county commissioners don't have to approve this. In 1977, the governor appointed this board as the lead agency for SIPs. So this board is the only one, and Billings, I guess, their pollution control board are responsible for SIPs in those two counties, Yellowstone and Missoula. What we'll be asking for the county commissioners and the city council is just a resolution saying, yes, please redesignate. I mean, it'll be a little wordier than that, of course, but we're in favor of that because the Federal Clean Air Act requires that we consult with the transportation community and local elected officials. So we have to have evidence of that consultation. But they don't actually have to approve it. This board has to approve any SIP changes, and so does the governor.
So is there, for this board, what, it would come to a hearing?
A hearing in December.
In December.
Yes.
That's
Is there a timeline for the rest of the bullet
Yeah,
items
we'll
there?
try to get it accomplished before the hearing with the city council, county commissioners, and TPCC. So we'll be going to public health and safety, for example, with the city. I'm anticipating the Wednesday after Thanksgiving, and then probably going to city council the following Monday.
So really, that bulleted list should be two lists. One is
Right.
a formal approval process. The other is the consultation process, which has
Right.
3 entities on it, if you add TPCC.
Yeah, and so then we're looking at possibly setting a public hearing for December 18th. Would would we be taking action on it at that time as well?
That would be up to the board if you
That's something
wanted
we
to
could-
delay.
so-
If there are some substantive concerns, I'd probably recommend not taking action. on it.
Right.
But if there aren't any major things that emerge.
So
then
this
we can
could
do
be,
that.
this could be going to the governor by,
December
by the end of December.
19th.
Okay.
Could-
Yeah, I just was kind of wondering.
There's still some draft parts here.
I know that there was continuing communication with DEQ, and I've been gone a week, and up till then, there was continuing about the process, because this is not a well-oiled process for them, we're the first doing it, but if there were substantive issues or reasons for the board not to take action in October,
In December.
excuse me, right, last month would have been nice.
Christmas.
Yeah.
Your head around it.
Yeah, I know, it's terrible, you know, the day of the week, the year of the month. Is it still true, as we understood at one point, that if it doesn't move this year, this calendar year, that we could, EPA could re-trigger the entire, are we clear
No,
with that?
that has been clarified. We have more time than we thought. The
Okay.
use inventory will be good into next year.
Yeah. We thought we could, trigger and a whole new look back.
Yeah, so we're okay with that.
Okay,
The-
thanks.
The way it's stated in the federal rules is you have to use the 5 most recent years, and once you get into the next year, then, because this emission
We were worried
inventory
about that,
Right.
ended
yeah.
January 1st, 2014.
Right.
So,
Yeah, in the past, when we put through our air pollution control program, that has actual rule changes, and then that has to go through BER, although it's just, I think, in the past been thumbs up or thumbs down. They
Yes.
can't really open and dissect it.
It's only veto.
Right.
But this one doesn't have any
No.
rules in it, so
No.
it's more expeditious.
but DEQ does have a 30-day notice requirement also before it can go to the,
It's a huge amount of work, so
Mm-hmm.
I appreciate what goes
Yes.
into it. You give diplomas over at the university.
Yes. Sarah earned a diploma over the last 2 weekends, yeah, she had a lot of semester credits.
Titles behind
She
Sarah's
was-
name.
Yeah, I've been on a lot of committees where there wasn't as much substance as there is here, so anyways, wanted to give you a lot of credit for some hard work.
Thank you.
This is an action item, so we always give the public a chance to make any comments before we take action. Anyone from the public wish to speak? Anyone else on the staff or the board wish to add anything? If
just
not,
like
then
to
I-
thank Sarah for all her hard work, and Ben too.
And Ben too, yeah. So it's a division of 2.
Yes, it is.
Everything gets done at the same time. I would accept a motion then to set the public hearing for December 18th.
So moved.
All those in favor?
Aye.
Chair votes aye also. Very good. Onward and upward.
Thanks, sir. Thanks, Ben.
Thank you.
Let's see, the staff is going to update us on the nuisance odor.
Yes. Well, we have really no updates, that's the update. We're not surprised, because we suspected a biological process, that the complaints have all but, I think they have disappeared. I'm not aware of any complaints since the very last, you've had one since?
Not a complaint, but the odor was detected once.
Okay. And we've been making staff, frequently making trips over there to try to sniff it out. But we did have, and still do have, 2 pending investigation parts of the work that we were hoping to get done before we got to this time of year with cold weather. One was, we expected would have been done today, and it is not. And that is to test the integrity of an underground vault, its ability to hold liquid, not be leaking over at Emerald Oil. They did agree to do that. They then had a spill in North Dakota that took priority for their environmental folks. But we renegotiated that it would be done by the end of this week, and as of this day, it's not. The other was to have probably Jim go up on the top of one of the tanks and do a physical inspection. And the safety information that we need to move that forward isn't coming forward, and now the weather's getting such that that may not be working. That said, we do tentatively have our next task force meeting. It had met every week until 3 weeks ago, while we were waiting for these types of activities to take place. Accomplished a lot, as I reported. We were tentatively scheduled to meet Monday. I'm feeling like we should still go ahead Monday unless the task force members don't want to, because I think we do want to get a better idea of what is going on and when might we be able to complete the investigation pieces, or do we have to wait till the spring? And then the bigger issue, I think, is we cannot assume that this odor isn't going to reoccur as the weather changes again in the spring, and we'd like to be prepared to get a jump on it much more quickly than last year, and so that would be one of our agenda items. So that's kind of where we're at. And after those two investigatory pieces, we had exhausted, we as a community group with industry represented and Garon and staff, had pretty much exhausted everything that we could think of to look into. Did a lot of potential mitigation along the way. But I don't want it to just dribble off, not get the group back together, and at least be ready for the spring so that we're organized, just like you're ready for the flu every year. When the odors start coming in, if they do, we're ready to move. That's what we have.
Any questions for Ellen on that? The rest of us?
Did the brewery thing lead to a dead end?
I can't say it was a dead end, and I can't tell, it definitely had a significant odor, very bad, and a lot of visual, on the inspection, visually, it was covered with material that could create that odor in a short period of time. And then they were instructed, it was power cleaned, and they were instructed how to prevent that from happening, and the gentleman from wastewater was following up on that, so we'll check with him again.
Okay.
That said, that odor was not identified as the signature odor by some people. So we may have had two odors going on, but.
But it could have led to eventual problems.
Mm-hmm. Yeah.
And it was identified by some people as the signature?
It was not identified as the
Anyone.
signature odor
Okay.
by anyone that, but the gentleman from wastewater treatment said that it was very odorous.
Choke a skunk.
Yeah.
Choke a
Good-
skunk, yeah, is
good
what he
thing to
said.
fix.
And we
So-
did have neighborhood complaints at another brewery where they then also took those mitigating steps of capping the manholes, and I'm not even sure they had to do the power washing. So,
Right, well, that one is not on a, end of line situation.
Yeah.
This brewery over here is the very first discharge into that particular gravity main, so it's nothing but them and
Right.
just a few houses as you go west, so.
Right.
The pipes were coated with yeast, and yeast has a very high,
Sulfur.
pure yeast has a very high sulfur content, so if it
Yep.
decomposes, and when they get done with the brew, they dump hundreds of pounds of yeast down the sewer. So,
So is that dealt with by their pretreatment?
well,
they need to
yeah, one of
wash
the,
it.
they have a grease
Rinse.
interceptor, which adds some problems, because it gives you a delay and a good anaerobic digestive period, because it's several thousand gallons, and then they've been encouraged that when they're done dumping to flush it with water for
A lot of
several
water.
hours to
A lot
make
of
sure.
water.
They dump on Wednesdays, and then they have to flush, and if it still builds up, lesser, but still builds up, then city sewer can either power wash it and bill them or require them to power wash it, because it shouldn't need that more than once a year. So that was definitely an issue, and it was a problem, but it has not been identified as the signature problem.
I guess power wash is a good description. They call it sewer jetting. I mean, there's a jet that goes into the sewer mains and cleans.
Yeah, so essentially we found a problem before it really reared its head.
Right,
part of the problem.
Or it may have.
Mhm.
Yep.
Because not everyone that ever reported was at our focus group in order to identify a signature odor. So we have a broader area of reporting than the number that showed up to your smell-a-thon. And mitigation was done at Emerald all along the way too. But right now, we don't have data, don't have complaints. It's a good thing because this staff did have to get this done. And as you can see, it was tight to do both, so.
Is there like some public announcement or news release or something that said, I mean, I think that would be a great, other than on the television, that says, this problem came up. The good news is, it's nothing that is going to, as far as we could identify, it was nothing that was toxic in the sense that it was not a poison,
Mhm.
but these are the steps that have been taken, the cold weather,
Mhm.
you know, and we will reevaluate. I just think that would be
Yeah.
Mhm.
like.
I-
Bring a little bit of closure.
I think not everyone on the task force would be willing to go quite that far with that statement.
Well, what if it didn't come from the task force? What if it just came from the
Yeah.
health department that said, we've,
We're-
okay.
Yeah,
Okay,
we're on the
different.
task force. I mean, we can say it wasn't methane,
Yeah, okay, well,
yeah, and that's all public, and it's on our interested parties list, and it's on everything. But I think what we need to do now is just stage ourselves for spring and see where we're at in the spring.
And the methane question was probably the potentially most dangerous thing
Right.
that it could be.
Right. That's-
Yeah.
So that's where that's at. That's all I have on that
Good.
for on Monday.
Anything more for the odor issue? Next is the Air Quality Advisory Council update.
Sorry, I'm getting. So the advisory council update. So the advisory council met, we had to reschedule, we had a Monday meeting on the 10th, I believe, because our regular meeting fell on election day, so we rescheduled. And a few brave souls came out. It was extremely cold. We got people come, and we pretty much gave them a very similar updates to what you just got. We talked about the odors issue updates a little bit, and we talked about the upcoming limited PM10 LMP. That let them know that that's going to be in their inboxes prior to their December meeting, so they can have a chance to look at it. I'm planning on emailing that to them because it is a giant file and weighs a lot. And I figure they might appreciate an email version. And we'd have some vacancies that we will be looking at applications for that in the summer meeting to fill the alternate vacancies.
I have one very promising candidate.
Yeah, and actually I have another gentleman who wants to apply as well, so that's.
So one is a person who's done policy work at the national level, I believe has a JD
Yeah, lawyer.
degree, and is now the American Lung Association person for the Missoula area.
Oh.
So that's a great person to.
Yeah. So that'll be good.
I don't believe a quorum was present.
Yeah, so it was mostly
So
just
two
a
of us
chatty
that were
meeting.
there can't vote.
Yeah, it was a nice meeting to discuss some things, but we couldn't actually vote on anything, so.
Right. And the Transportation Policy Coordinating Committee met Tuesday when I was administering an exam, so Sarah went in my stead.
I did. So the TPCC met They had a couple of action items. One was to approve an amendment to the Unified Planning Work Program to set aside $3,000 out of the reserve fund, I think it was, so that there's potential to hire an intern or work study type person to help with data collection and gathering and entering for the upcoming LRTP. So that was approved. And then they also approved a memorandum of agreement between Missoula in Motion and the Bike Walk Alliance. The reason that they are kind of more formalizing their relationship is they do a lot of the same projects where they work together, but WAM is a nonprofit and there's more different kinds of funding available to them, and so being able to kind of work together on projects where different agents, they can kind of find additional funding sources by having that agreement in place. So that was approved. There was a presentation on bicycle and pedestrian count data. A permanent automated counter was installed on a trail, I think near the walking under a bridge near the university, and it's able to detect pedestrians and cyclists with really great accuracy. They set up a camera to see is the counter match what we're seeing, and it was like 95% accurate. And it's real-time data, and it's year-round, and you can see it on the internet. And so that gives them great information about what kind of pedestrian counts we're seeing and how it impacts weather and whatnot we'll have on who's going where. So that helps implement the counts that they do with volunteers. But it supplements that, and the goal is to add several more of these automated counters in the coming years to really get a good picture on the folks using alternative modes of transportation in Missoula.
Wow.
So that was a good presentation, and then they also had a presentation on a bicycle infrastructure design workshop that a couple of folks went to, Ben Rice and Aaron Wilson went to in Oregon, and they learned a lot about how you design a city to make it bicycle friendly. The good comparison that was put is, you don't design roads for sports cars, but bike lanes are designed for that 1% diehard will bike in any situation, and there's no fear. But studies have shown that that's 1% of cyclists. 1% of the population will do that, and there's like 5% that are pretty diehard, and 60% who like to ride their bikes, but it's scary. And so how you design that into your city to make it more comfortable and help traffic flow as well. And so they had a lot of good things they picked up there, and it was really very interesting what they learned, what Portland has done, and maybe some things that could be incorporated into Missoula. I know that in the Russell Street project, there is a cycle track that is supposed to go with that, I believe, that helps separate the cyclists from the drivers, and I think that goes a long way toward increasing confidence for those folks riding their bikes.
The university's done some of that on campus, and then they have the green boxes like
Yep.
Portland has
Yep.
over on the new intersection there. I always thought it was interesting that the bike paths are so great until you get to the intersection, and then they sort of disappear, and that's just when you need some security as a cyclist.
Yeah, and the Portland's method of using those boxes is actually to make a pack of cyclists, like get all the cyclists up into that box, and so they get through the intersection faster, and then cars are able to turn and not have this flow of cyclists coming past them.
Right.
So that's kind of a neat thing. So they're good presentations, and that's pretty much your TPCC update.
Any questions for Sarah? We always have an agenda item for public comments on air pollution control board issues that weren't on our agenda. Anybody have an issue they would like to bring up? We offer the same thing to board and staff members. I have one item. I picked up the Kaiman today, and it had an article about grads win contest for air quality plan. The only problem is, I don't think they've talked to the air quality specialists down here and linked up. And I don't think the reporter did a very good job. At least I was disappointed. The second paragraph I brought copies so that you can have copies of this. The second paragraph opens with, Missoula's air quality is deteriorating. And that's disappointing since we're just filing a maintenance plan saying we've made great progress. It talks about getting a D from the American Lung Association as a grade, but that's up from what would have been an F underscored 4 or 5 times in the past. So I just was disappointed that the story didn't have a more positive arc to it. And I thought, if these guys are setting up a plan to put in an air quality sampling network all over Missoula, wouldn't it be great to coordinate and interface with the professionals that are here? So I brought the article down so that staff here can try to get a hold of these entrepreneurs who have these little Raspberry Mini detectors that they like to send out all over the place. So I thought that was worth bringing. The story concludes on the back page. So.
A little problem with the Zoom. You know, you get zoomed in and you don't zoom out.
Right.
Who's the professor?
They're graduates. So they've started their own little company.
Oh, I just assumed, I saw that, I just assumed that meant that meant they were
They already
students
graduated. Now, they probably were in my class, but they probably didn't go to the EBST lecture that I annually give on air issues in Missoula.
Boy, are they in trouble
Or at
now.
least the reporter didn't. So anyway, I thought I'd...
In there,
Yeah,
graduate?
something, yeah.
Well, I know that some people have had diplomas rescinded.
I'd also point out Butte's under an air pollution alert today, and we aren't.
Yes. Pardon?
Butte is under
Oh,
an
Butte's
air
under,
pollution
okay.
alert, requesting people not to burn their stoves.
Okay. So anyway, I just thought I would share that story with you, being very timely since it just came out this morning. Anything else for the Air Pollution Control Board? Then we will adjourn as the Air Pollution Control Board and reconvene as the Board of Health. I don't believe we have any minutes to approve at this point.
No.
So, Dr. Roberts is going to give our journal report.
You have in front of you a journal article called Invisible Risks, Emotional Choices, Mammography and Medical Decision Making. Should I sit over there?
If you'd like.
Yeah, why don't you pull it up for me? And I'll... So this is not exactly about mammography. It's, I think the interesting thing here for us as a public health board is to look at some of the issues that are brought up in this article. And the particular one that I was interested in, our particular interest that I think applies to us has to do with the risk. And this gal starts talking about risk, and she distinguishes it between are we aware of what the risks are, and does that actually change what we want to do? And is related to actual risk, you know, like how dangerous is something, but how do we feel about risk, which is quite different than what the actual risk is. And we could probably spend a semester on this one, looking at this. So I'm going to take us on a quick tour of risk, and we're going to use mammography as sort of the straw woman to discuss. So the Swiss Medical Board did an independent technology assessment and looked at what the effectiveness was of mammography. And what is, I think, striking is that, and this is true not of just mammography, but of lots of things, women perceive the effect of mammography to be dramatically greater than it actually is. So if you look at the top section, A, what do women think about the benefits of mammography? They think that there's a significant number of women that would die if they don't have mammography. This is 1,000 women that are screened every 2 years with mammography above the age of 50. Women's perception is that without screening, 160 women will die from breast cancer, and with screening, there's a 50% reduction. The real effect, if you look at this, is that without screening, those 1,000 women, about 5 will die from breast cancer, and with screening, 4 die from breast cancer. So there's a huge difference in perception and what actually happens. And we'll talk about that difference a little bit here. So this is sort of similar to the prior slide. You might prevent 1 death from breast cancer by screening 1,000 women every 2 years for 10 years. But what you also do with that is have a lot of women that turn out with false positive mammograms. You have a lot of unnecessary biopsies. And I think this last one is really particularly interesting. Apparently there's a significant portion of breast cancers which never cause problems. In other words, women get identified with a breast cancer, it gets removed, they get treated, but between 1/5 and 1/3 of these breast cancers would never clinically be apparent. And so these women have breast cancer, they get treated for it, but they would not have had problems anyway. So the Swiss Medical Board looked at this stuff and made some recommendations, which was, it's not very effective. They suggested no more screening programs, no new ones, that the ones that existed be limited and in fact maybe terminated, that clear and balanced information be presented to women, and basically it's sort of a negative approach to mammography. And what's the result of that? I mean, it's like, whoa, what? So, and similarly, the U.S. Preventive Taskforce recommended in 2009, for similar reasons, that women less than 50 not have routine mammography, that those older than 50 be screened less frequently. And since that time, screening rates have actually increased, even though it's not really clear that it does much. And so this article that I shared with you investigates this. I mean, sort of looks into this issue and postulates a couple of reasons why. One is that maybe women, and again, this is not limited to women, it's sort of limited to humans, that maybe we don't mind being a little anxious if we have a false positive mammogram or a false positive prostate antigen testing. That anxiety is okay, but if we actually show up with breast cancer or prostate cancer down the road and we didn't get tested, that we feel bad about anxiety, about regretting that we hadn't done something more than the anxiousness of having a false positive test. I think it gets a little more real when we think, we start to understand risk, which is that feeling in danger is not really something about thinking, is it? It's really something that we feel. And so it's hard to be rational about what we feel. And some of the articles that I read on this topic, as I sort of got interested in it, and some of the books talk about fear that we have of breast cancer or prostate cancer or fluoride or you name it, and what do we do with regard to that fear? We want to control it. And so if you say that you can't get mammograms anymore, there's the fear of breast cancer and sort of a loss of control if you take away mammograms. So I think that's a lot of what we as public health officials are dealing with when we talk about what are the risks and what are the actual fears. And I'm sure that Ellen and everybody else that's in public health already thinks about this, and I'm just coming on it, but it's an ongoing issue. And the interesting thing is that if you educate people about risk, it actually doesn't help very much. So there was a study that was looked at and just came out in Pediatrics this year, which is effective messages in vaccine promotion. And they found some interesting things, and I just wanted to emphasize this, but among parents who are least likely to vaccinate their children, if you give them more information which says there's no link between vaccination and autism, that makes them even less likely to vaccinate their kids. So giving them more, intellectual stuff doesn't help. And if you show these people pictures of children dying of measles, in other words, you try to figure out ways to make them more convinced, it actually goes against you. So people became more convinced of the link between vaccinations and autism when you start looking at this. And apparently this is well known. That is, if you try to challenge beliefs by showing data which would suggest that the beliefs don't have any basis in reality, you actually firm those beliefs up. You don't make them go away. And that's hard for me to understand, since I like to think that I'm rational, but this happens with politics as well, right? So
There's just be Congress and climate.
Right.
yeah, climate change. I mean, you can think of how many, and it makes sense, because what we do is we further polarize by talking about what is real. And so, if you educate women about mammography, I showed all this stuff to my wife, and she says, I'm still getting a mammogram. And,
Yeah.
she digs her heels in even more. And it's fine. I'm not there to convince her. I'm just showing her. So I think she's pretty educated, and, but you can't. This makes her even more likely to get a mammogram every year if I show her these articles. So it's not hard to think about other health examples, public health examples, and I just listed a couple here. My daughter lives in Portland, Oregon, and she's quite incensed that they recently there was a ballot measure to put fluoride in the water. And she pointed out to me that Vancouver, Washington, which is just across the river, it's a much poorer city, a lot more folks living in poverty there. They fluoride their water in all of Washington, and they have 40% fewer cavities in children. And yet, these smart people and educated people in Portland, Oregon are not about to put fluoride in their water, and the more you tell them they're wrong, the less likely they are to do that. Ebola is another interesting thing, and I just picked out what the judge said about the quarantine restrictions. People are acting out of fear, and this fear is not entirely rational, sort of obvious. It's not confined to mammography or vaccinations. PSA testing is another issue that comes up in medicine a lot. We've got an issue with hepatitis C. Great drug to resolve hepatitis C, but only 1/5 of people with hepatitis C really go on to develop problems. So, and the medicine costs $95,000 a course. It's $1,000 a pill. So you can bet that the drug company, which has already made $8.5 billion of profit on this medicine, is going to be pushing the treatment of hepatitis C because it works. But only, a small portion of people really need to have that treated. So you could, I mean, we run into this kind of issue all the time. So this is really what I wanted to get to, which is the tension between actual risk and risk perception. What do you do with that? There's often a disconnect there. Cass Sunstein, who is an interesting author and wrote Nudge and a lot of other books, one of which I just looked at, he says, well, you don't really fight the battles, you just create policies which make it easier to make the things go right. Which is sort of the opposite of the current medical approach, which, and she argues here that it's a case of not really answering the right question, but that these decisions are personal. So if you want to get a mammogram every year when you're 40, or maybe you get one twice a year, do it. And we honor our patients' preferences, even if they don't make sense. And the author points out that, and I like this statement, it's as much our job to figure out how to best help our patients lead healthier lives as it is to honor their preferences. So it's sort of a middle ground. And I guess that's really what we do here, is we listen to the individuals and we try to weigh the social consequences and come to some middle ground. So I think we just find ourselves in this place between what are the actual risks and what are the actual fears, and how do we reconcile them. And that's, I guess, what we do as a public health board a lot of the time. Anyway, that's the article.
Very interesting.
That's great.
Reminded me a little bit about the fact that with refined foods, people were starting to have deficiency diseases, beriberi and pellagra. And during the war, Food and Drug managed to pass regulations that any commercially produced flour had to be enriched with iron, niacin, thiamine, riboflavin to take care of those problems. And that's where we sort of used policy to lead to some resolutions that would have been difficult to encourage people to
One by
address
one.
otherwise. And then later on, they put in folic acid in the 1990s to help spina bifida problems.
In the, is it Sweden, where they did this is on YouTube or video someplace, where they talked about increasing exercise, and they should start with a video at the train station of all these people coming off the train and getting on the escalator instead of walking up the stairs. And so they rip out all the stairs and put in soundboards on them and then paint them so that they look like musical keys. And over a period of time, people walk up and down.
Well, that would
And
be-
over, I mean, literally, they watch it over time, and it's like people stop using the escalator. But you could say, walk up a flight of stairs, walk up a flight of stairs, and they didn't do it. Everyone's like, oh. So you have little kids that you're trying to drag up the escalator because they're going,
Well, that would be an example of Cass Sunstein's, nudge. How do you
Right.
how do you create the environment that he would argue that you shouldn't have trays at fast food places, because if you don't have a tray, it's harder to carry more food, and you can show that people that don't have trays eat less.
All right.
In grocery stores, if you see that the flooring frequently, or in other stores, this is like social marketing stuff, the flooring changes so that as you're rolling over a cart, how easy or how the sound changes in areas where things are either on sale or are.
Oh, yeah, it works both ways, of course. I mean, you can do social engineering to make people buy things or do things that are not good for them.
Right, yes,
Yes.
You can. Very good. Do we have a volunteer for the December report?
It's been a long time since I've done
Okay. Thank you. Now we have a whole lot of guests some of who are strangely familiar. I thought I got rid of some of these people from my lives when I passed them in my chemistry course. But we always like to hear where the students are from, so maybe before you start your presentation, if you could just introduce yourself, where you're from, that always is fun to see.
I'm glad you said strangely familiar and not just strange. I appreciate that.
This guy in particular.
I think, before you even start, I want to say how we not only enjoy having the students here, but the projects that the students do are things that, and this is a perfect example, things that are not only done well, but things we've been wanting to do sometimes for a long time, would not otherwise get done. And I think that you'll see that, it's very evident in this particular topic. So I think, Sarah, you were going to introduce the topic, and then they can introduce themselves. So these are MSU College of Nursing students, seniors.
Bill and Erica they graduate in just a couple weeks, so they're very excited. And this has been one of the most meaningful projects that I've been involved with in my short period of time here so far. And I appreciate the work that they've done on this project. And they've also laid the groundwork for future students to come in next semester and pick up where they have left off and hopefully kind of complete the whole circle with this project. And the project starts with our CHIP, the Community Health Improvement Plan, where the immunization clinic is tasked to do rural outreach to the communities in Missoula County, like Seeley Lake, Lolo, Frenchtown, Bonner, and do immunization services within those communities. And that's been a challenge. Since I've been here in the last 18 months, we've tried to do a couple back-to-school clinics in Seeley Lake area with minimal success. And so this is where Bill and Erica spearheaded the project, and they chose Seeley Lake to be that starting point, and they did a really great community assessment, which I'm going to let them share with you guys here today. So Bill and Erica.
They're both familiar.
Thanks, Sarah. So I'm Bill, and this is obviously...
I'm Erica, and gee whiz, I had you for chemistry. Took my prereqs at U of M. So
I've never told anybody this, but I had him twice for chemistry. The first time didn't go so well, and I promptly left, but then I got remotivated 15 years later. So we'll kick this off. So the survey, as Sarah mentioned, is sort of based, or not sort of, it was based around the Community Health Improvement Plan, and specifically it was to discuss alternative methods of immunization and vaccination in rural areas of Missoula County. And we did focus on Seeley Lake specifically. And really it was just sort of to define, are they using MCCHD for immunizations and vaccinations? What's driving that decision to use them or not to use them? And then if there's an interest to expand that. If they're not using us, why are they not, and would they like to? And how can we assist with that? Just a couple of demographics about Seeley Lake. So the rough population in the city, in the town, is 1,700. Median age is actually older than the median age in Montana comparatively, about 10 years older. About 350 students in school. And the income's just about $5,000 less than the median of Montana. The survey overview. So the survey had 8 questions. We'll go through each one of those with you real quickly. All of the respondents indicated they were from the Seeley Lake community, and we completed a total of 62 surveys. And I'll turn it over to Erica to go through the questions with you.
okay, question number 1. Have you used the health department in Missoula for immunizations within the past 12 months? You can see overwhelmingly 87% of the respondents answered no, they had not used the health department. Only 13 said that they had. If you want to access immunization services at the health department in Missoula but don't, please tell us why. Most people felt that it was the location and it was a real barrier, the drive to Missoula. Some people were concerned with the hours of operation, and others were just unaware of the services that we provided. Some of the comments that were made is it's too far to drive, or it's easier to go to a clinic or pharmacy in Missoula. Question 3. In the next 12 months, will you or someone you know need the following immunizations? Overwhelmingly, people responded for the flu shot. I should state here that people chose multiple immunizations that they may need for themselves or their family. So 49 people said that they would be interested in a flu shot. Childhood immunizations, infant and teen immunizations were also important. Not many people were interested in travel immunizations. Where do you prefer to access immunization services? Most people said that they prefer to go to a healthcare provider for their immunizations. You can see in the other category here, 24 people said other, and most of those people would like to go to the Seeley Swan Clinic, which was why they responded other.
That's the other portion
It
of that.
is.
Yeah, we made an other category, but, and not all people that responded other were interested in the Seeley Swan Clinic, but most of them indicated that's why they were choosing the other category. If MCCHD were to offer a back-to-school immunizations clinic in your area, would you bring your children, and what is the most convenient time? So 60% said yes, 17 were unsure, and 23% said no. But we needed to make note that here we did not include, we gave this survey to everyone, even people that did not have children, and so that no category might be larger because they were considering themselves not having children. And most people felt that evenings and weekdays were the best time for them to have access to a clinic. If MCCHD were to offer a flu shot clinic in your area, would you come? And when would you prefer? So this is specifically for a flu shot clinic, not a back-to-school clinic. And 49 out of the 62 respondents said yes, they would come to a clinic. And again, people preferred evenings and weekdays.
This one here, we just threw in this comment because we felt it was important. This gentleman we talked to had tried to get a shot twice, and on both occasions he showed up and they were out of the flu vaccine. So we wanted to make the point that people are really interested in trying to do the right things, and sometimes in his case he couldn't drive to Missoula and we didn't meet his need last year. So hopefully we will this year.
If MCCHD were to offer a local immunization event of any sort, what location would best serve your needs? Most people responded that they would prefer to come to a school, and there are 2 schools in Seeley Lake. Other people said a clinic or community center. And some people had some great comments, such as shift change at the mill, or a open house at school, and some people said that they would just prefer to come to Partnership Health. So last question, how would you like to hear about future immunization services available in your area? I think this question really represents the type of community up there, which is a smaller, older community. Most people responded they would like to see events posted in flyers at local stores and on the radio and TV. So some of the comments that were made is that elderly don't use much social media up here, so it's easier for them to see flyers and hear on the radio what's going on. The Missoula and the Pathfinder were sources people identified, and really overall people were very excited that we were taking notice of their community and just felt like they were happy that we were looking into services to provide for them.
So that was all the questions. The recommendations we came back to Sarah with were convenient and consistent immunization clinic. So it's great to have it, but we have to have the vaccinations that people need on hand when they do come in. And then the consistency portion of that. There's been some turnover at the clinic. People don't know what to call the clinic anymore, if they should call it partnership, if they should call it, they don't know what to call it. And I don't know that they really care. As long as they can go, it's available, and we're consistently there, I think we'll be meeting their needs. Another recommendation would be to utilize what we're already doing, which is things like WIC, and send a nurse or perhaps another nurse to just do immunizations, vaccinations, advertise, so this is just straight back at what the community told us, advertise in a means that meets their needs, which is flyers, Pathfinder, and the radio. Then minimize confusion about the roles of MCCHD and partnership. I just think people are generally confused up there.
Yeah, we found through dialogue, talking with people as they're filling out the survey, that there's a real breakdown in understanding between the role of what the health department does and what partnership is doing, and what partnership offers up there. Many people didn't understand if there was a doctor available. They didn't understand if they could receive immunizations right there at the clinic in partnership at Partnership Health. So really, I think some more outreach to the community from both agencies would be great in just defining what's available in a clear manner.
And then further assessment. So what else, in addition to immunizations, can we be providing them from the MCCHD standpoint? So just look for further opportunities to serve the community. And then going forward, as Sarah mentioned, survey the other outlying areas of Missoula County, because as we found with Seeley Lake, it's very different than, say, going to Frenchtown or Lolo. They have specific needs, as every other small community would have. So we can't really lump them together. From our perspective, we really just wanted to thank Sarah and MCCHD for allowing us to do this. It's really, I mean, it's probably one of the more beneficial clinical rotations we've had. It's really a great partnership, and really you gave us all the opportunity and the direction we needed. So it's a great partnership between MSU and the health department, and we hope that it continues because it was really beneficial. So thank you very much. And that's it. Any questions?
Well, I just want to say that since you guys have started this project, that there's been some really great partnership with Partnership Health Center. Mary Jane from over there is in charge of the Seeley Lake Clinic, and she invited us to do a flu shootout at the clinic office up there, in which we did 99 flu shots for,
Wow.
for the Seeley Clinic. So that was a great turnout. And just Tuesday of this week, we went back with them to do a mill shift change clinic.
Great.
Based on
All right.
part of this. And there was 47, I believe, that they saw.
Oh, that's great.
Great.
Pyramid,
We're
is that-
excited to continue working on that partnership and support each other and reaching out to that community. So I thank you guys very much for
Thank
your
you.
groundwork.
That's cool.
Thank you.
Yeah.
I have a question. What was the average age of the people that actually participated and filled out the survey? Did you find that there was a wide age range, or was there an average age?
That's a great question. We didn't have a specific question asking what their age was, and we went up on 2 separate days. So the day that I was there, it was during a festival time, and I would say that most of the respondents that I talked to were somewhere between the ages of 28 and 45. But I know the day that I was there, because Bill, I'll let him address that, but he went to the school and were working with people that had more children. So I interacted with more people that didn't have as many kids. But we didn't actually specifically ask for an age.
I would say that my respondents actually were closer to that 48-year-old range. I spent a lot of time at the local grocery store. They were very accommodating, gave me a chair and a table, and that was without any prior planning. I just showed up and told them what we were doing. So they're very open to our input and for us to do the surveys. But most of the people I ran into at the grocery store sort of fell into that 40 to maybe 60 range. So.
Just out of curiosity, did any of them talk about the way the health department has been working with them in the stove program too?
Not with me.
No, I didn't
Okay.
hear that come up. There was a lot of mention of how they felt a little bit isolated as far as health services up there, were some of the comments that came up, but I didn't hear anybody address that
Okay.
specifically.
Because I think we've really been working more with Seeley Lake of late.
it's been
and
good.
I was just interested if that was,
But that would be perceived, that would be, not be perceived necessarily if you talk about health services.
Right.
Even though we say, well, clean air is sort of the bottom line.
So I'm just curious.
We didn't point it out. There was a few respondents that were concerned about immunizations and autism.
Mhm.
And as Dr. Roberts mentioned, we didn't go out of our way to educate them because research shows it would only defeat what we were trying to do.
It was good reason.
Yes, yes,
I wonder what happens if you say it does cause autism.
right.
I believe there were 5 out of the 62 people that we surveyed that said that they did not believe in immunizing, and we included them in that data.
Great.
Thank you again for the
Yeah, I
time.
plan to attend the next travel immunization clinic here at the health department. Gonna go visit my daughter in the Dominican Republic.
Nice.
Thank you very
Great
much.
to see you two again.
Thank you.
Great, thank you.
So, next on our agenda, Ellen is going to talk about community health assessment.
Actually, Robin's going to do that. So Robin Nielsen is, Cindy Hotchkiss, Robin Nielsen, and I served as the hosts or conveners of this process. It's our second community health assessment, believe it or not. The first 3 years are almost over, because it is indeed November, not October, and the next thing you know, it'll be December.
More than halfway through November.
And the process convened in January and operated every month and will again. Our community health assessment is much broader, as you've seen from our first go-around. It had broader representation, a longer process, more indicators, almost scarily so. It has been out for public review in a number of ways for the last almost month now. And that is on our website, and there's a survey on the website, so it's on our Hot Topic site. We also got newspaper coverage, other media coverage. All of our community health work group members have taken it to their boards or their agency to try to get that same kind of input. And the questions we're basically asking is, did we miss anything gigantic? This is not a priority setting document. This is a gathering of information document that then is to help us lead into the community health improvement plan, in which we have to be extremely specific and disciplined in priority setting. We are also going out to at least 4 of the 7 outlying county community councils. I think we've got 1 done and maybe 3 to go. Two done and 2 to go. And also sent it, although we aren't visiting all the city neighborhood councils, it was sent some time ago through their regular means of communication, so they have access to it, taking it to city council. And we had a public meeting last night at the library as well. So this is officially your hearing. However, so much of the input started last January and has continued to this point. What we hope to do today is to see your basic impressions on it, hear about the input we've gotten so far, see if there's other input actively from today's audience or from you, with the hope that it can be adopted as Missoula County's community health assessment in December. There are some requirements that our sponsoring parties have to meet, and they don't always gel really nicely. So for example, we have to have a community health assessment and a chip and all the other activities, like you just got an update on activity on the chip, at least every 5 years. But our local hospitals, currently still being nonprofit, the IRS requires them, and this is a rather new requirement, to have a community health assessment and a chip every 3 years. So if we really want to work with each other, we have to go to the every 3-year schedule, which frankly is huge. We are working with our partners immediately after this process to figure out how to do that more efficiently, because we can't spend a whole year out of every 3 doing a community health assessment and then actually do any action on those items. So we do want to get it adopted because the IRS requirements for our hospitals that it has to be adopted in 2014 to be effective January 2015. So that is, that said, if you see any major gaps, we would just as soon respond to you about what communication the group had, or if it was completely missed by the group and it should be put in. What we would not be able to accommodate very well is changing this several times on into January. So we really wanted to get it to you a month in advance, actually 2 months, but 1 formal month in advance of when we feel to meet all the partners, IRS and other requirements, it would be adopted by the end of 2014. Putting this together is huge. Everyone that you're looking at here and our staff gets credit, as well as you had members of your advisory councils come to these meetings and represent those processes all the way throughout. And then, excuse me, Robin, our master journalist, finally somehow sieved it all out or distilled it and got it out there. And so since she knows it best, she's going to take you through some highlights, lowlights, and then address any questions you might have.
Hi.
Great.
I'm Robin Nielsen-Sircone. I work in health promotion for Cindy Hotchkiss, who's our accreditation coordinator as well. And Ellen, did you just want me to use like some of the highlights I put out for the press
and
release?
where we
or-
stand out in a good light and then sort of like the newspaper. And
Sounds
then
good.
we can go just based on the board's interest to any of the alphabetized
Sounds good.
topics.
And we did decide to go alphabetized this year because I wasted an awful lot of time trying to figure out how to organize this in a way that made sense. And there were a lot of discussions there were some very animated data discussions at some of those meetings about, well, no, this should go with, personal health rather than, it was, and it's hard. I mean, there's a lot of issues that you can slice almost any way you want to. So we decided we can put them alphabetically and people can pull out whatever parts they want to. And I also did find that a lot of places are going to that kind of, a lot of the official websites and such. So it must be a issue that everybody's wrangling with. Oops, I'm sorry, this is a really touchy mouse. I'm sorry I can't get this to display a little better, but I guess you've all got copies in front of you. But the table of contents, then we still did divide out a community profile, so that's data that just more, it gives a big picture of the community. So, we're thinking that if people outside the community wanted to know more about Missoula, they could kind of look at that section first, and then the key health and community resources, and get a better picture of what's available here. Those sections, though, also have some trend data and comparison data as well. But then the health profile is just the whole schmear of everything. And I think every single thing on this list was something that the group as a whole, the child work group, decided on and wanted to include. There was a couple things at the end I realized that had been in the last one that was not included. So I went back to the group and, just let them
use
know.
that plus and minus little thing if you wanted to get a whole page on it.
Oh yeah, where's the plus and minus?
See the plus and minus on that little bar down there at the bottom?
Oh, that's
There
cool.
we go.
I did not know that that's what that meant.
So if you hit the minus, you can keep clicking that, and that'll put more and more.
I see.
While we're at
There we
it,
go.
let's do this.
There we go for you, Garon.
I can't see.
I can see it just fine.
Yeah.
So you can go back and forth.
It'll
as
just
needed.
help you guys get to your own page. It's nice to have people who know what they're doing. Oh, you want it really big? Okay. All right, we'll do that. I'll do a lot of scrolling.
It's closer to the mouse, he wins.
There we go. All right. All right, so anyway, so as you can see, there's a lot of stuff, a lot more stuff. There, in this particular report, which I think is a bit different than the last report, we have added in the section on community input, which we will add some more stuff now that we've done the community meetings and go into the outlying areas, but that is on page 67, where we just kind of briefly break down what we did and what we found out when we were there. And so there'll be a page of that added in there. We also included a health inequities page, partly because our revised accreditations, standards and measures, want us to start doing that, looking at health inequities very deliberately. And also because as we did some of the background work and talked to people, we realized that there's just not a lot of data for the urban Indian population, and there's not a lot of agencies that work really closely and really well, so that there's just a lack of knowledge. And so we actually worked with Leanne Johnson, who wrote most of this section on health inequities
From the
for us.
Missoula Indian
And,
Center.
Yeah,
She's
she's
their new director.
the new director. And we did a focus group there, Cindy and I, and we actually have had some really great communication, which I hope is going to lead to some nice working relationships.
We had an
because
aging
of this.
services focus group, so that's in addition, that's new from the last time we went through this process.
Yeah. And then we also added this section on urgent and emerging issues. And the group together decided on these 3 issues: aging population, climate change, and poverty in young adults and young families. And especially the poverty in young adults and young families came out of some of the focus groups, as well as the child work group. All right, and then we also added a section of data we wish we had, because there was so much of that. I mean, that actually could have been about 15 pages long, but those were the major categories, and so maybe it'll make us think for the future, I don't know. And then the community resources is a long table. The focus group questions are in there in case you want to know what we asked. And then the Missoula County Health Survey results. This is a survey that the hospitals did together. They ran 2 focus groups and had a survey online. It didn't get a ton of responses. I think it was 288. But so it's kind of like a big town meeting online. And so we put all the responses in there, and they're also summarized in the community input section as well. So highlights, I'm just gonna, I think, just quickly point out what I put in the press release, because they were things that struck me. I mean, you can find something in almost any section that would strike you, so it's a little bit artificial to have to pick out just a few. But one thing that is maybe a little surprising is our diabetes and obesity rates are, compared to the nation as a whole, good, although if you compare them to the 1980s, still horrible. So I mean, we're following the whole nation trending up. We've followed the whole nation in obesity tending to plateau out a little bit. But we're better than the rest of the country for what that's worth.
So diabetes and obesity rates are continuing to increase, but we're better?
We're better. Obesity has plateaued. But we're much worse off than we were 25 years ago. But as far as the nation as a whole goes, we're in that bottom 5th for obesity rates, and we are somehow the best state in the nation on diabetes at the moment. But when you take into account the margins of error, it's like there's about 5 of us that are clumped at the bottom. So some of those rankings are a little, pointless, I think, in some ways, but
Still good.
still good. And we also, and I did not have any breakdowns that I could compare directly for the diabetes for just Missoula County, but Missoula County tends to be the lowest diabetes rate in the state. So we're at least towards the bottom of the state. So for what it's worth. And then low birth weight. The reports from Community Medical Center are, I'm not even sure on what page they're on. Let's take a look. I guess I could put up these pages while I'm talking about them. That would help. So birth weight.
33.
Thank you. And I'll try to get there as fast as I can.
I think you have to add 4 if you're using the PDF.
I have to do what?
I think you have to add 4 pages if you're using the PDF.
Oh, that's right,
counter.
yeah.
So I did this
Okay.
with City Council and
Thank you,
managed
I
to get us all
forgot
confused.
about that. I know, I had a hard time with the page numbering issues on Publisher, so you'd think it would be easier, but it's not. All right, I'm almost there. Almost.
Birth weight's just before cancer.
Yeah. Okay, so here we go. So the numbers from Community Medical Center, these are just the numbers that I think you get from county health rankings, and so just the basic numbers that we get, where obviously we're lower than even the Healthy People 2020 goal. And then when Community Medical sent over their own analysis, what they have discovered is that when you look at babies just that are from Missoula County, because of course Community Medical Center's numbers come from surrounding area as well, we actually have quite a low rate. Of the 45% of their births that were Missoula County births, of those, the overall low birth weight rate was 3.6%. And 4.1% so far in 2014, so that's a lot lower than the 7.2 or whatever. So that's pretty significant, I think. So those are three of the ones that stood out. Other things that stand out are that we do really well on is our alternative transportation, active transportation, recreation levels, stuff like that, or possibilities. And then of the, let's see if I can get to DUIs, the areas of concern, things that stand out. Yeah, DUIs, even though we've gotten things have improved quite a bit, we're still among, our rates are really high compared to the, I'm sorry, I'll get there. There we go, okay. Compared to the, the nation, and I don't have great comparisons here. I got this from the local DUI task force and such, but they keep tons of information on what's happening locally. And but when you compare out our crashes, it's really high. And then it says, when broken down by age group, the 15 to 20-year-olds have the second highest impaired crash rate in Montana, even though this age group can't legally drink alcohol, so we definitely got. But as you can see, things are getting better, but in our crashes, but we're nowhere near good. The other things that popped up as areas of concern were mental health, and I have to tell you that comes up in focus groups over and over and over too. Just access to mental health, just complete lack of access due to lack of insurance or not being able to get into addiction treatment, or you name it. It's huge. So that's a huge issue. Then prescription drug abuse, we rank really high in problems with prescription drug abuse. Is this almost? Okay, come on. No, that's not gonna do it either.
See if the cursor will
Where's the
take you.
page? That's what I was
Sometimes the
trying.
cursor's not
page
as
down.
jumpy.
I always forget about page downs, thanks. So there's obesity.
That's in our.
Page 56.
Page 53.
All right. Yeah, let's see what it'll take me. Did that do anything? Here we go. I'm just doing this. All right, so prescription drug abuse. Boy, it's really something to pull that data out, I tell you. There's all kinds of stuff, and it's hard to figure out how to slice it in layers that can be compared. But what we found out, this is kind of the take-home right here, is that when SAMHSA ranks the states for prescription drug abuse, and this is taking prescription drugs without, not with the doctor's orders, Montana is among the worst 10 states for ages 12 to 17, 6.77% to 8.36% have used in the past 30 days. For ages 18 to 25, we're among the second worst group of 10 states. And then for ages 26 and over, we're in the middle, just smack in the middle with that. So it seems like it's a problem that's going to be growing, since our young people seem to be exhibiting the problem the worst. And then the last thing I was just going to call out was radon, which, there we go. And I like this little map because it's so clear. The red means you have really zone 4 hard, is it zone 4 or zone 1? I could. Anyway, it doesn't matter. It's the worst zone. It's the bad zone, the one that tends to have the geology and the underlying issues that create high radon levels in homes. No, zone 1, sorry. And, there we are, smack there, all in Montana. And then this is from really great follow-up that's happened in environmental health here, where this is just from tests that have gone through environmental health here, so it's in no way, representative of the entire community as accurately as we would like. But of all the tests they've done, when they divide them out, sort them out by zip code, they find that the average level in every single zip code is above the action level of 4. So, and obviously some of them are really huge, although some.
5982.
59821, I think, is Avero.
Oh, there, it says right after the sides,
Yeah.
it's
Where?
the north of the 93 I-90 interchange, it says, yeah. And then Clinton and Frenchtown have the highest average levels. However, those also probably have some of the smaller numbers of people who brought in tests, so it's hard to know
So you get a
exactly
higher-
what that means. But it would be really interesting to, to be able to do some more expanded testing and kind of see how that all plays out. So I think that's all I have to say. Is there anything else you'd like me to, okay? Any questions from anyone?
Fascinating reading.
Yeah, very, very
Great
neat
graphics,
done.
too.
Oh, thank you.
I have a question that you may or
It's a
may
lot
not
of
be able to answer. And maybe somebody in economics can do better on this.
Oh.
On page 11, when you talk about poverty levels and the living wage versus the minimum wage. Anyway, so when you get to, on the third line, it says, figures the living wage for Missoula to be $17.22 per hour for a household. That means, though, if you've got 2 adults and 2 children, you mean if that's the income for both
Yeah,
people?
yes,
So-
yes,
So,
yes. Yeah, so, yeah, and I will say that this particular website figures basic bills really basic. It's like if you're doing the cheapest rent you can do and you have no extra, so, but yes, that's for both. And also, if I would like to put this out to the board, I never found anyone to really find me information for the economics section. The group told me what they wanted, but I never came up with an expert to really guide me through this. If any of you know someone who would be willing to look through these 2 pages and help out and give us some different, please feel free, because I just never located that particular expert.
The BBER over at U of M are really great. I mean,
And I did talk to them, and they were super willing to send me to websites, but I kind of need that one champion who will read the page for me. So if
Yeah.
anybody knows anybody, let me know.
I'll be tired, maybe he'll just review it.
Yeah, so, because, I don't know that much about economics, so I just put together lots of different pieces, so.
We did Missoula Measures, which was a similar report back in the 1990s. And I've kept a page from that report and use it constantly in my classes. And it broke out how many people in the county have this kind of income. And the number of people at the low end was extremely surprising to me. And I've been hoping to get an updated version of that.
If you send it to me, I'll try to see what I can do. Even if
Okay.
I don't do it in time for this report, I
Okay.
could maybe get you something, so.
Because I like to do a demonstration where I take the world population and divide it into 20 birth certificates and pass them out in 20 cookies. And the first world countries, the 5 first world countries get 16 cookies. The 5 second world countries get 3 cookies, and the 10 third world birth certificates get 1. Then I did the same thing with Missoula County, and I broke it up into 20 cookies and 20 birth certificates. And the cookies aren't very well distributed, and it would be nice to have that data to.
That would be great, yeah.
Just to respond to that, we are going to be updating Missoula Measures as a whole. It's part of a quality planning process that we're going through right now. And the intent of it is to use some of the data that we have, to have all of the data that we have in the community health assessment on Missoula Measures and go into depth a little bit more on Missoula Measures, because we won't be limited by page number at that point. So we're working on it.
But the Bureau of Business and Economic Research, did you talk to those folks?
I did, and they were super helpful with sending me to websites or showing me the stuff on their website. But really, I think some of it is just, I just needed to find the one person who was interested in this project, and since none of them really understood exactly what I was talking about with this project, it's harder to get them interested, so
Just
I'm sure
in the
there's
past
people
year,
there.
though, they've hired someone to be in charge of health issues.
Oh,
and
I
so
should contact,
we
yeah.
can try to find this.
That would be great.
Part of our discussion isn't just obviously the topics, but what is the best indicator? So when we do turn to the experts, there's 18 indicators for any one thing or more. Which is the one that's most telling? That we're able to track, and that's part of what when we didn't have that expert or have that conversation, we just left it to Robin, and she worked pretty hard to figure it out.
Robin, I have a name for you too of somebody.
Oh, okay, great.
Yeah. I actually have some some comments on this, but I think it
No, I
might
love-
be better to, if I could just sit down with you. and
That would be
go
wonderful,
through
or
it.
you could email me, and you should know too that it's gone through, I've been collecting comments from the group and from other, like, managers in the department and other experts and people online too, so there's definitely some typos and oddly written sections and stuff like that that I'm just trying to do the changes in clumps, so I just did a series of changes yesterday, and after you all get me your comments, I'll do another series of changes, and so it actually looks better than it looks right now.
So do you want to come in and have a sit down and go through it?
Yeah, I'd be happy to.
Yeah, I mean, that probably would take 10 minutes, but are
You
you
can
going
do
to
it
be around
however you
after
want.
this meeting? I'll just.
Yeah, I can be
Fine.
around. Mhm.
Yeah.
Okay, that'll be fine. Sounds good.
Great work, though.
Yeah, it's
Thanks.
amazing.
It's a lot.
Right,
Yeah.
I
It's
just
a
have
lot
one
of
other
work.
quick question. I'm
Yeah.
sorry, I wrote notes as I was talking.
No, it's great.
Under the section when you talk about health inequities and then directly lead to urban Indian populations, I understand on reading it that we're clear that there are health inequities related to urban Indian populations, but is the Indian Center okay with that? I guess I'm wondering about the.
They wrote it.
Yeah, they wrote the
editorial for-
they wrote the
it.
section, and actually,
And knew it was going literally under health inequities.
Mhm.
Okay.
And I have a Native American graduate student, and she wants to do her PhD in health inequities.
Yeah.
So
Well-
that's something that they're
Okay,
really
I
paying
just
attention to.
wanted to.
Yeah.
So
Yeah, no.
they'll like to see that it's being recognized.
The breakthrough that the Missoula Indian Center brought to this process this year is night and day from the last attempt, and so they actually wrote it.
yeah. Well, and it was interesting too, because we didn't have so much of the data in, they didn't, I had some of this data that I had in originally. Leanne, the director, wrote a section, and then, but it didn't have the data, and so we worked together to kind of get it to fit together, so it had the data piece that we needed for this report in, and then also the text that she needed, but she actually says, having something in a report like this about health inequities is going to help her apply for some grants, so,
Great.
which is the gold standard kind of for this process. It'd be nice if all our partners could use it in the same way, so.
So we'll have to go from very expansive to very specific, doable community health improvement plan. It's going to be a complete opposite way of thinking in our next step. And we have to do it efficiently, otherwise we'll be sitting around talking about these things and not out there working on them. So that's kind of a scary encounter we had this time.
Who has to do that?
All of us.
Thanks.
The whole work group.
And that is something that we would like your opinion on. If you're looking through the community health assessment, we're collecting input from the community and from our partner organizations, and we would like to hear from you as well for if there's an indicator or a couple of indicators that you would really like to see in the community health improvement plan. Because we're trying to take everybody's thoughts into consideration as far as, whether we keep some of the, one or both of the indicators from the last one, or if we move into a completely different arena. So everyone's opinion is welcome. We'd really like to hear from you.
What were
And
our
we-
last two? Would you remind us?
Childhood obesity prevention and access to health services, including population-based and preventive health services, were our two areas. And they can't be umbrellas. They have to be very strategic, and particularly since I think we've come to terms with the fact that we have to be on a 3-year cycle. I really wish we could be on a 5-year cycle. So we might be looking at chapters, like on obesity, we may be looking at, well, we achieved one chapter, now let's write a doable second 3 years. I'm not sure how we're going to do it, but it's going to be, again, a completely opposite way of thinking, because it has to really get down. And we have to show improvement. Even though they are owned and operated by the community, we have to show, the department and the board, show improvement in those arenas. So it's tricky work.
And there is online on the health department website, there's a link to this report, and there's also a link to a survey, which includes asking for input on what you would like to see the community address in the next 3 years. So.
There's a very nice visual appeal to it.
Ah, good.
It's very, very nicely done.
Good, thanks.
I think personally that, well, maybe it's my own biases, but I just think with sort of the way of the world, the poverty-related issues, whether it's homelessness, home security and food security are gonna be really, but I don't know what all we can do
Right.
related to some of those
It's-
things, but I think food
Right.
security is gonna, it's so tied into the diabetes and the obesity and all of those things.
And that actually came up last night when we were talking at the library, the same terms.
Thanks.
I'll
Thank
come
you.
look for you.
Yeah, Robin does the writing, but the rest of us do work. She's the writer. It's astonishing. She's a master's in journalism, and yeah.
Shows.
It shows.
Yes, yeah, very
Yes.
neat thing.
Yep.
I couldn't stop turning the pages when I
Yeah.
started
I
looking
know.
at it.
It's sort of
And
like
then I'm sitting here
the encyclopedia.
looking at Sarah's and Robin's and knowing how quickly they took really a year's worth, more than a year's worth of data and ended up putting it together for this meeting.
Yeah.
Yeah.
I got 2 books this time. That's what I told my wife.
Yes.
An Ebola update.
We are continuing our weekly health emergency advisory team meetings and also participating in other such weekly advisory calls. The latest news in terms of, we've added an additional country of concern has been added, so when we're screening for possible risk of returning travelers or visitors, Mali is now a 4th country to look at. We had a heat meeting this morning and very well attended. City Fire, Rural Fire, Western Montana Clinic, both hospitals, Curry Health Center, Police Department, this department, DES 911. Really, people are showing up, and that method of working with heat appears to be working well. And they're planning a drill probably in mid-December to see a drill would focus on transport, but we talked this morning about having a drill or a tabletop that would also focus on public information, because I actually think that's the bigger deal. And with the best of preparation may not be real manageable. So that is what's going on here. There are 8 people in the state of Montana currently or recently, maybe discontinued, but 8 total to date that have were being monitored for the 21-day monitoring requirement. And so that system of having folks land at one of those 5 airports east of us, with the one in Chicago, O'Hare being the furthest west, and then getting their travel information, their contact information, relaying it through state health authorities to local authorities, appears to be working. I'm sure that there's ways that doesn't catch everybody, secondary travel, for example, so we're not relying on that catching everybody. And that's kind of where we're at with that. So it's still keeping us busy.
I like that. How would you relate that to Tom's journal report?
It was real, it's, some people draw, as Joyce Dombrowski did, the parallel between HIV and healthcare worker fears and stuff, and I think there are a lot of parallels there, but there's some differences as well. That said, when I was taking phone calls, as many of us were, for a pretty good period of time when the St. Pat's story received the attention it did, the people that called that were frightened, I would characterize as truly being in fight or flight mode. Truly. Because once they were so into their own moment of that, and once I would get past saying, well, no, there isn't a patient here now, but then I would try to explain, this is how it works, this is what could happen here, try to go into that part. That was it. The fright, the mode that they were in just went away when there wasn't a patient there now, and they were done. They went right back to a different state of mind.
Mm-hmm.
So it's what you described, only on a very exaggerated, base of the brain kind of reactionary level. Kind of frightening to encounter.
That's where a lot of us operate.
Yeah. Yeah. I think, though, the difference, at least in my opinion, between HIV and Ebola is really we didn't talk about HIV for a long time at the federal level or any other level. And here we're talking about it as if, Ebola was truly present. And in fact, it's not, very much. So I think that's interesting, that maybe also goes to your point of your article.
Well, talking about it as if we're prepared for it if it comes, not as if it's really here, but
Yeah.
don't worry, we know what to do.
Yeah. It's, so yeah, I haven't encountered kind of that level of fright at a community-wide level, really, in some time. I've, had anger, disappointment, confusion, you name it, and you always have to try to de-escalate or disarm. But this was just definitely,
That's
are
outright
they here?
panic.
Are they here, or are they not here? And if they're not here, then I'm done talking to you. So.
And I can say that as we've gotten more information out to the public, the questions that we're getting are much more logical and reasonable in the last couple of weeks, now that things have kind of settled down a lot. People are looking at it in a much more enlightened way. But it definitely was a panic situation for the first couple of weeks.
Mm-hmm. And our staff put together Ebola 101, which you can find on our website, and it has an interactive quiz, and we do try to refer a lot of people to it. We're very glad to go out and educate our closest partners and other partners in the community, but we didn't want to get overwhelmed with doing the weekly lunch circuit on Ebola issues. And so we're trying to steer people to Ebola 101. And then if they continue to have an interest, then we would consider further education. We're pretty busy with the hospitals and the other partners.
I'm going to turn the meeting over now to Ross, because I need to head to Idaho to Wizard.
Hey, have fun.
Can't you fly?
Pardon?
Like mere mortals.
Well, then the next item on the agenda is a director's report and accreditation update.
So I completed a site visit, my first, and I was the lead site visitor last week, and in my opinion, it went very well. I learned a lot, and it just strengthened my, I've said I'm a convert. I went from not wanting to accredit to wanting to accredit very well. And I just came away feeling like I knew more and much more strongly in that direction. And I encountered Tom Roberts on the airplane that I almost missed and that my luggage did miss, leaving Missoula at 5 in the morning. And you were just sitting there happily reading a newspaper. And I think I was swearing. I'm not certain, but I might have said a few things that were, because it was way too early.
You didn't look that happy, but I don't think I heard any swear
Good,
words.
good. I shouldn't have even admitted to it, but I was mumbling anyhow. That said, though, I totally enjoyed the visit and was reaffirmed how, I don't know it's bragging, but how well this department and board did in that process. So we are reopening our recruitment for the nutrition manager. And we actually have a good slate of applicants. We actually have 14 applicants this time. We changed the minimal requirements enough to open that door a little wider. So I'm encouraged, but that position remains unfilled. And our remodeling is moving along, maybe 2 weeks off schedule, but it's moving right along. There's a big move this weekend.
About the billing person?
Yeah, that's what I was going to ask too.
The billing person, we are right in process, in fact, in the middle of a communication need as of this morning that doesn't put me in a position that I could tell you exactly where it's at, because that communication needs to happen.
But the process is moving.
Yes, it is. Okay, it's moving. That's all I have.
Next item is public comments on items not on the agenda. Okay, that's no public comments. And then, so next, with no public comments, board and staff comments on items not on the agenda.
I have an announcement, and my announcement is that I'm leaving Missoula County. I don't know exactly when, but probably by the end of the year. I'm pursuing another job. If that doesn't work out, I will go home and think for a bit about what I want to do next. So I've been at Missoula County for, it'll be 26 years in January, and for a couple of reasons, it feels like now is the time to think about what the next stage of my career is going to be. I want to let you know. Don't know exactly when yet, but
We're gonna miss you.
well, this has been an incredible opportunity.
That was the other part of the story that you referred
That's
to
right.
earlier.
Yeah.
No, that's terrible.
For us.
Yeah.
For us.
Yeah.
Yeah, no. It's great working with
Thank you. Likewise.
Was it something that we said?
No, not at all, not at
Too
all.
many
It's just been
lawsuits.
wonderful. Wonderful, wonderful group of people to work with.
Marty is our bedrock, so I can barely comment on it, so we'll just, I guess, face it when we need to, and wish you the best. If anybody deserves a break these 25 years, you do.
Time does come, doesn't it?
It
when you need
does.
to,
Oh, I had a birthday and it was like, oh my gosh. I just
Right.
had, illuminating.
Well, good for you.
I would just like to add that in the past year, Marnie's devoted time to us on an almost weekly basis for contract meetings, and her help has been very significant and has made a big difference for us. And so I will miss working with her.
Where is that not the case?
That's a hard act to follow.
That is. That
Sober moment.
leaves everyone speechless.
I came from this morning, the meeting of what used to be Montana or Missoula Best Beginnings that I believe we've started calling Healthy Start Missoula. The group that puts together, it's all the organizations and support services related to early childhood, early family, and it's the group that made the multicolored this Best Beginnings community-wide booklet that went out. I wanted to just make sure that everybody knows that it is in process to be, that there is, it is available on the website. If you go to the forum, you can, it'll be updated, but you'll be able to hopefully click and it'll be easy to access information. The other thing I wanted to tell you is that as a result of, hopefully you can help me if I forget what that, if anyone needs to know what the letters stand for, but part of one of the things that the McBee funded was some information about the GIS mapping. And so we had a presentation on the mapping, the GIS mapping that will be going through or that will be theoretically available as soon as it's continued to approve through the city and county health department, where we would be able to, if you had access, go into the cloud and do all of this overlapping of all kinds of data, so that some of the things that we're talking about, like, well, the one I made them do was water fountains within so many, 100 feet of there's a bus route. It's like, okay, so we found the water fountains and the breastfeeding
Friendly places.
facilities or whatever. I mean, there's like lists and lists of things
Wow.
that you can access to it, including where there are the most children under 5, various ages, and what we'd like we'd ask about that may get added in at some later point if we have more local information about crime rates, et cetera. Just so any of the information, what it made me really thrilled about was the idea that all of this community assessment, we would really be able to just take big chunks of data. I said it back to what you talked about in the article about changing people's perception. Back in the day when I was in school, everybody that was a new mom got a home visit by a nurse, public health nurse. It was just like everybody did, poor, rich, healthy, not healthy, whatever, everybody did. And now we have nurse-family partnerships, and signing up and participation is not as high as we would hope or expect. And I said, I think that our marketing should be, are you on the map? That, because we can track it. Like,
That's
oh,
cool.
everybody in our community has been visited by their nurse, or everybody in something. I said, I want a phone app so that I can say, where's the water fountain, where's the whatever. But I think that we could figure out ways to make it really useful and a community benefit.
We're not used to looking at those kinds of resources or risks on the map. We're much more used to, roads and bridges and bricks and mortar and this and that. So this is really our first entree into that.
But and some of it certainly is risks, but some of it is like benefits. Like so, because then one of the things that that some of the folks from early Head Start were talking about is then they could, in a perfect world or in some period of time, if you were working with a family that needed resources or had resources, you could literally print out a map for them so you could figure out where the resources were and how they would get there. Because there are places that don't have public transportation lines, that we don't have, and don't have real good data as to, well, we don't have a lot of people that would use them, but it would be, in my mind, supporting information if we said, yes, but we've got families that live out here that we want to have come for Wicker Well child visits. And as somebody from Child Protective Services said, because if you live in a place where there's no public transportation and you walk down near the highway with your baby in a stroller, somebody will call Child Protective Services on you. It's like, well, if you've got no way else to get to the bus. Anyway, it was just really fascinating. So we were all, here was this poor person prepared to do this like overview of all this, and we're like, can you find this? Can you show us this? What if you laid that on top?
Yeah, so we need to do a demo here.
Yeah, it was really,
that would be nice.
it was really cool. It was really cool. Oh, and my other thing is that the Maternal Child Health Advisory Council has openings. We've rescheduled our meetings. We will be having one in December, and we've put the word out to people who are interested in participating in the Maternal Child Health Advisory Council to look at the overview of the charges of the Advisory Council, and then and I'm blanking on to send a letter of interest or an email of interest to Pat Buffington.
Yes, thank you.
I have visions of trying to remember the names and then completely blanking on it. Okay, those are my two things, but the GIS is so cool.
With no other comments, that adjourns the Board of Health meeting, and we'll convene as the Water Quality District Board. And do we have minutes?
So we do with their May 15th.
Yeah, I'm sorry, the agenda did get revised, it's the May 15 minutes that were.
We do have a quorum.
You just have a
for
quorum.
That's fair.
You got 5, that's what you need.
So, Water Quality District minutes, I saw an interesting spelling of Spurgeon.
Oh, yes.
Okay.
Thank you. I caught that at one point and then I lost going back to.
Arnie, is it important that we have verbatim minutes?
No, minutes need to be accurate, but they don't need to be verbatim.
I'm not used to seeing verbatim minutes like this, so I'm just curious as to whether we need to
It's something
have
that I think we've wrestled with for a long time, and not just at this board. I think to get verbatim minutes, you need some sort of system. You have to have a court reporter, you have to have some recording system that can also be easily transcribed, and for most boards, that's sort of unworkable with that investment. So, I think that we're working, I think the effort to have these more detailed minutes was linked to some comments during accreditation about what they wanted to see. So, and that's why you're seeing, I guess, the more detailed, but legally it isn't required.
It also, actually, believe it or not, takes longer to because they're recorded in a whole fashion to edit them down. So it is, we've gone back and forth. We actually did deliberate verbatim, then we did very short, kind of action-oriented ones, which would not work for accreditation. What we look forward to is the county actually being able to have similar to what the city has, where we can have it, a person can go in online and actually Zoom to the actual part, the recording of the meeting, and then we could have shorter minutes. We can't have just electronic minutes. Those aren't recognized by law yet. But then we could definitely have less language in the officially adopted minutes if we had those
We had a
recordings.
recording of the meeting.
Yeah, so
That
city
was
council
posted,
does
that
that
was
now.
Publicly available.
Yeah,
you're
it's
saying?
accessible.
You could go right online and search it. We have these recordings, but they're not, we don't have on the county website a way to upload those and search them and so on and so forth. That's a big piece of software. The city invested, I think,
I'm
close to.
tempted to say if you had it, it wouldn't work anyway, but then I was looking at Julie, so. That's all.
It wouldn't work anyway, you've had problems.
No, it's worked fine at the city.
Yeah.
Because all of our tech problems.
Oh, we are tech,
I mean,
yeah.
I can't even get on the internet half the time just to post
Right.
print files, so.
But with the county's change to a website coming up, and I think the contract's probably been past you at least once, I don't know. So I mean, when it's not just talk now, there's a
Right, there's a plan.
Right, with the new county IS director, things are moving in a way they didn't. And the new website should, if I'm understanding it, allow us to use those types of
Right.
recordings and then have much less commotion and in the actual written record.
Yeah, I could see how these would be useful potentially if you wanted to look back and say, you know, what was said and what was discussed.
Because it's a 5-year look back.
Yeah. I'm just not used to seeing minutes that
They're,
are this detailed.
yeah,
Right.
they are
Close to a
detailed.
transcript.
Yeah. Well, I have seen it in court recordings, you know, when I've been looking at testimony, unfortunately, but, yeah.
Well, I prefer this to the court reporter version when we've had that before, because she records and writes out every,
I know.
that we say.
Always a humiliating
It-
exercise to read transcripts.
And,
Yeah, and then when we read how we speak, it's just.
Those were horrible.
No, yeah.
You know, like,
Julie makes us look a lot smarter.
Right.
So I was looking at the minutes and I had a question about hydrodynamic filtration of stormwater. We applied for grants. How'd that
Yeah.
work out?
Let's see what I can recall accurately on that. Maybe you're even more up to
Remember that?
date.
We did it, so.
Yeah, okay.
It's in, so.
Is it even working?
No. It's submitted to the program, so it was an RRG, DNRC, RRGL grant application. Those go in May. They get ranked in the fall. They've been ranked, it ranked very well. And the governor's budget that just came out 3 days ago looks, the way he put it in for the legislature to review is that it would be funded for engineering and construction. So we don't ever know. April would be the earliest. June is the reality for when they'll split it back out.
Thanks. We do things, you know, here and at the council and everywhere, and sometimes we don't follow up and see what happens to them, so thanks.
Yeah, the project was ran very well, so I think that even if they didn't fund the whole list, if they took the top 20, it would be funded. If they took the top 10, it might even still be funded.
So now we need to find a way to recycle cigarette butts.
Yeah.
Or
That's
stop
the thing that was
smoking.
fun about having it be, the minutes be old enough, and I'm thinking, wow, that was really good work. What-
Speaking of minutes, do we have a motion to approve the minutes?
So moved.
All in favor, say aye.
Aye.
So moved. So then, public comments on items not on the agenda. Seeing no public comments, board and staff comments on items not on the agenda. Looks like the Water Quality District Board is adjourned.
Good.
As are all the-
Do you just have to